Hello friends. Today we're going to discuss about parent-child interaction therapy. I'm Dr. Suresh Padadmat, Professor of Psychiatry, working at National Institute of Mental Health and Neurosciences, Bangalore. In this video, I'll be discussing about disruptive behavior disorders, how parent-child interaction therapy plays a crucial role in disruptive behavior disorders, what are the evidences with regard to PCIT therapy, and also I'll be discussing about collaborative problem solving therapy. Disruptive behavior disorders. These are group of disorders with severe behavioral problems in children. They are called disruptive because affected children literally disrupt the people and activities around them. The disruption may occur at home, maybe at the school, along with peers, or else in any social situation. Disruptive behavioral problems, which include aggression, oppositional behaviors, non compliance to the adult's request, and many a time they seek revengeful. Disruptive behavior disorders include oppositional defiant disorders, conduct disorder, intermittent explosive disorder, and disruptive behavior disorders NOS. These are the disorders come under this context. If you look at the prevalence of disruptive behavior disorders, it varies between 3 to 16% of the children population. This range occurs based upon various reasons. The first of all, whether the study was done in a general population or else in the school, what is the screening instrument, who did the study, who are the people who administered various diagnostic instruments, whether the study was done in urban, rural, or in slum population, what is the definition of the case, what was the age of the children. Based upon this, the prevalence varies somewhere around between 3 to 16% of the children. If you look at the treatment, evidence base up to date on the psychosocial treatment of disruptive behavior in children. This was a study done by Kaminsky and Clausen in 2017. This study was published in Journal of Clinical Child and Adolescent Psychology. This study is a systematic review of the research on treatment for disruptive behavior problems in children, that is, aged less than 12 years. And this review clearly stated that highest rating of effectiveness for disruptive behavioral problems was found in parent-child interaction therapy, that is PCIT, and also in parent management training, that is PMT. I have done a separate video on parent management training. Please visit my YouTube channel. In this video, I'll be focusing more on parent-child interaction therapy. Now, let's look into the assessment of disruptive behavior disorders. First and the foremost, high index of suspicion, good clinical history, mental status examination, ward observation, temperamental history, detailed evaluation, collect the collateral information from peers, academic institutions, school teachers, report cards, law enforcement agencies, if there is conflict with law, counselors, siblings, relatives, and parents. There are few structured instruments to assess DBD, but the gold standard is clinical assessment. If there is marital discord or family discord, we may have to do family assessment. When the patient is brought by their parents, look for the referral. Who is the source of referral? Is it the parent they brought themselves? Is it the referral from the school or from the law enforcement agency? Take a brief history from the parents and the child. After that, talk to the child alone. Ask the child what was the reason for consultation, why their parents brought him there for consultation. What is the perspective of the child? What does the child thinks? What is happening with him? After that, talk to the parents alone. Later, have a joint session with the parent and the child. Look for the interaction between the parent and the child. Sometimes you may have to do family assessment if there is severe violence, domestic violence, and marital discord. If there is any delinquent behavior, ODD behavior, or a disruptive behavior, focus on the recent behavior. Ask for what is the antecedent, what was the behavior, what was the consequences, what was the severity, how frequently it is occurring, how long it lasted, and how many people were involved and what was the setting. Look into similar disruptive behavior in the past. Look whether there is any pattern to it, whether it is pervasive, whether it is limited to one setting or two settings. This kind of assessment has to be done. Assess for comorbidity. Invariably, DBD also has comorbid other psychiatric diagnoses such as ADHD, SLD, mood disorder, depression, anxiety disorder, separation anxiety disorder, and various other symptoms. Hence, assessment of comorbidity plays a crucial role because invariably you can give medications for illness such as ADHD, substance use disorder, mood disorder. If there is SLD, you need to address SLD first. With regard to treatment of DBD, psychosocial management is the first line of treatment. It may be PMT or parent-child interaction therapy. Medication plays a crucial role in addressing comorbidity only. Invariably, disruptive behavior disorder do not have any medications. Now let's discuss about the important parent-child interaction therapy. What are the evidence? Recently, Thomas and colleagues published an article in Pediatrics. The title of the study was Parent-Child Interaction Therapy, a Meta-Analysis. This is meta-analysis of many studies which was published in 2017. In this, Thomas and colleagues reviewed 23 studies which included 1,144 children and it was compared with the control. On comparing, invariably, the children who received parent-child interaction therapy showed significant reduction in parental stress and also child-related stress. Children who received parental-child interaction therapy observed to be more compliant with parent request compared with controls. Parent-child interaction therapy effectiveness did not differ depending upon the sessions. How many sessions, what was the duration, or the child problems. That means parent-child interaction therapy was found to be very useful in children having disruptive behavioral disorders. Similarly, Ward and colleagues published an article in 2016 in a journal called Child and Youth Care Forum. The title of the study was Parent-Child Interaction Therapy for Child Disruptive Behavior Disorders, a Meta-Analysis. Here again, Researchers did a comprehensive review of 12 studies comprising of 254 children who received therapy versus 118 control children, and they were included in the analysis. The results of the study clearly said that parent child interaction therapy had a larger effect size in improving the externalizing behaviors in children with disruptive behavior disorders. Further, there was a significant difference between pre and post treatment with PCIT. On comparing between the children who received PCIT and the control group, there was a significant improvement noted in children who received parent child interaction therapy. There is no doubt the evidence and the literature clearly indicates parent child interaction therapy plays a crucial role in disruptive behavior disorders in children. Now let's discuss about parent child interaction therapy. Parent child interaction therapy is an evidence based treatment, especially children with behavioral problems. Parent child interaction therapy is conducted through coaching sessions. The coaching sessions are done during which parents and child are in a playroom while the therapist is in a observation room watching through one-way mirror. During this period, live video feedback is seen and the parents are coached in the live immediate manner, in which parents will be wearing a Bluetooth device, that is bug in the ear, through which therapist will provide coaching and also inculcating skills into the parents how to deal with their child. This is a live coaching of parents. This is also called as parents skill enhancement therapy. Look at this figure. You can clearly see that therapist is in another room using audio transmitting device watching the parent child interaction through one-way mirror. Here the parent is receiving the coaching through Bluetooth device during the play therapy. And during this period, the therapist will coach the parents how to parent, how to give attention, how to ignore the child's behavior which is unwanted. This is the figure you can see, the therapist watching the parents having interaction with the kids. This is a therapy which is evidence based, time limited. Each session lasts for 60 to 90 minutes. Invariably, 18 to 20 sessions are conducted. Some of the parents may require few booster sessions. Here it is an individual parent child therapy. That means as a family, as a unit, coaching is done. It is done for the children below the age of 8 years with behavioral problems. Here, parents learn the skill by therapist coaching during the live play therapy session. Before starting the session, you need to discuss with the parents the need for both the parents to be there, how the therapy is conducted, what is the cost, and ongoing consistent contact with the child, weekly attendance of the family with the therapist is required. The parents need to have an average cognitive skills, willingness to do homework by both the parents with the child. Each session will start with the reviewing of the homework. Next 45 to 60 minutes is the session proper, and finally 5 to 15 minutes is giving homework. Now let's look into the principle of parent-child interaction therapy. The first principle is learning theory, that is behavioral therapy. Here, consistently Reinforcing the desired behavior increases the frequency of the wanted behavior. That is, therapist will praise the positive parenting behavior. Parent praise the child compliance. By this, wanted behavior increases. That means reinforcement of the wanted behavior and punishment for the unwanted behavior can be understood in a simple words. Second important principle is attachment theory. In this, attachment in a secured form with the parent plays a crucial role in parent child interaction therapy. Warm and responsive parents leads to positive relationship with the child. With a positive parent child relationship, the child wants to comply and please the parents. Hence, secure attachment is the basis for the foundation of parent child interaction therapy. The finally, social learning theory. In this, modeling by the parents, by which the child will imitate the parents' behavior, in which parents demonstrating a calm, assertive, positive behavior in an interaction will help the child to model that behavior. Social learning theory is an important theory in parent child interaction therapy. Here, parents will be consistent, reliable, and still provide love to the child. Now, let's look into the parent child interaction therapy. It is done in two phases. Phase 1 is child directed interaction therapy. Invariably, 7 to 10 sessions are conducted. In the phase 1, which focuses on establishing the warmth relationship between the parent and the child through learning behavioral learning principle and applying skills proven to help the children feel calm, secured in their relationship. The objective of the phase 1 is to improve the parent child relationship, decreasing the negative attention seeking behavior and parental frustration, increasing the attention span, self esteem, security, safety, and attachment to the primary caregiver by the child, increasing the parent child interaction time helps to improve their relationship. In the process of phase 1, invariably, the therapist who is behind the one way mirror will be coaching the parents by using Bluetooth device. During the play therapy, invariably, since this phase is a child directed, child leads the play and the caregiver follows it. During this session, specific toys are offered during the play therapy. During the therapy, the therapist will coach and help the parents to become a play therapist. During this, the therapist will coach how to give active attention to the child, actively ignoring the unwanted behavior, selectively giving attention to the good behavior, announcing the child's behavior that I am watching so that the child feels that there is enough attention is given to him, praising for the good behavior. Such an interaction in the phase 1 improves immensely. After 7 to 10 sessions, invariably, parent directed interaction will take place. In this again, 7 to 10 sessions are done. In this phase, parents will be equipped and they will learn to manage the most challenging child's behavior. During this process, the therapist will ask the parents to be calm, confident, and consistent in approach in disciplining the children. Invariably, both the parents will be consistent in their sentences, in their disciplining pattern. Both the parents will speak in a single voice, confident and calm. In this phase, parents will learn to help the child to accept the child's limitation, to comply with the parent's request, respect the house rules, and demonstrate appropriate public behavior. The objective of the phase 2 is to decrease the unwanted behaviors, severe behavior, aggressive behavior, destructive behavior, and defiant behavior. During this phase 2, the objective is to increase the compliance to the adult request and to respect the house rules. Further, aim to improve the child's behavior in public and also to improve the parental calmness, confidence in dealing with the child. Not only that, it also helps to decrease the parental frustration. The process in the phase 2, here the caregivers learn how to give effectively the commands which are simple, directed, developmentally appropriate, and without any much emotion. Praising the child for the good behavior, for giving selective attention to the good behavior, ignoring the bad behavior. Further, caregivers also will be taught to do timeout sequences so that the child learns. For the bad behavior, there is a timeout, no attention is given. Once the child and the parent develops a mastery in the home-based situation, slowly it will be introduced in the public sphere. During this, the child knows what is expected and what is unwanted behavior which should be avoided. The outcome of parent-child interaction therapy is to increase the compliance of the child for the adult request, respect the rules, improve the public behavior, and further, improving the parent-child relationship, improving the parental stress, parental calmness, and confidence in dealing with the child's discipline. Invariably, many a time parent-child interaction therapy comes in a way when there are 2 or more children in the family and all of them are showing some amount of ODD behavior or disruptive behavior. In such a scenario, you need to choose the child with the severe ODD behavior or disruptive behavior and start using parental child interaction therapy. That child, along with the parents, will be brought to the therapist and the therapy will start with the child. Once the therapy starts, special time also need to be given to the other children. Similar behavioral therapy should be introduced at home to other children. If there are 2 or more caregivers, that is, there are parents, grandparents, uncle and aunt. In such a scenario, all caregivers need to be involved in parent-child interaction therapy, even if it is a single child, because the parenting should be consistent, disciplining should be consistent, and also the punishment. If you look at the improvement noted in the parent-child interaction therapy, invariably it increases the attachment between the child and the parent. It improves the attention span, more positive interaction between the parent and child, effective limit setting, the child learns, parents become confident, stress of the parents decreases, increased compliance with the parental request, and also pro-social behavior in children. Further, some of them may require booster session. You need to add certain activities, especially for generalizing the learned behavior of the child. Some of the parents may require crisis intervention if there are severe ODD behavior. Handholding and mentoring is very essential. Your handholding and coaching of the parents and mentoring of the child may be required in parent-child interaction therapy. What are the critiques of this therapy? Invariably, parental dropout is very high. 15 to 35% may not complete the therapy at all. The reason being, both the parents may not be free to undergo therapy. Hence, it is a major limitation. Further, not all children will benefit from PCIT. Severe conduct disorder, severe aggression and violence may not be indication for PCIT. It may not be able to helpful in children above 8 years old and in adolescent. Involving fathers in the therapy is a crucial, especially in parenting and disciplining the child. In such a scenario, leveraging digital technology plays a crucial role. As I mentioned, parent child interaction therapy or parent management training is helpful in children which are 8 to 12 years. What about in adolescent? Both parent management training and parent child interaction therapy becomes very limited in adolescent. In such a scenario, collaborative problem solving training becomes very essential for both adolescent and their parents. In collaborative problem solving approach, it recognizes that every adolescent with a challenging behavior are trying hard to behave well. They don't lack the behaving well in the society. They lack the skills to behave well. That means every adolescent wants to behave appropriately in the society and they want to be praised in the society. Since they do not have certain skills to behave well, those are seen as a disruptive behavior in the society. Invariably, collaborative problem solving is based on the premises kids do well if they can, but they lack the skills. What are those skills these adolescents with a disruptive behavior lack? Invariably, they lack flexibility, they have poor frustration tolerance, they are difficulty in adapting and problem solving. Hence, in collaborative problem solving, we need to focus in improving these skills. Kids with challenging behavior are tragically misunderstood and mistreated by the parents, by the teacher, and the society. Hence, this reward and punishment don't work, and at times it becomes worse. And invariably, disruptive behavior. Children will drop out of the school, will become friends with children with conduct disorder. They will have truancy, substance use. They get involved in antisocial behavior, delinquent behavior, and conflict with law becomes evident. Hence, in this collaborative work, we need to offer various plans to both the parents and the adolescent. In Plan A, the parents will be given do the way you are continuing, that is, impose your requirement on the child or the adolescent. That is the Plan A. That is, whatever is happening, continue that. Plan B, collaboratively solve the problem, both the parents and child. Plan C, decrease the expectation of the parents so that the child continues the way. That is the Plan D. Kids continue the way they are doing. In such a scenario, invariably, the parents and child will invariably coerced, discussed, and dealt with collaboratively to solve the problems in and at home. If you look at this, it clearly indicates Plan A, the parents will continue what they are doing. Plan B is collaborative. Plan C is drop it. That means you just drop the expectation. Once we decide about collaborative work, it runs in 3 important steps. First one is empathy. What is happening with the child? What is happening with the parents? What is their concern? That needs to be established. Now discuss about the problem. What is the problem with regard to at home? With regard to child's behavior, at the same time parents' behavior in retaliation to the child's behavior. And finally, inviting the stakeholders, both the child and the parents, how to amicably solve the problem. Now let's look into the step one, empathy. Explore the child's concern about the behavior of its own and also the concern about the parents. Explore the parents' concern about the child's behavior and what's the child concern. Verbalize. Ask the parents, what is the child thinking? What is the child's concern? At the same time, ask the child, what is their parents' concern? Once you are discussed, focused on the problem and the concerns involved, invite to solve the problem. Both the parents and the child invariably will discuss, will come up with multiple solutions. Now you discuss and list out all the solution. Look into the pros and cons of each solutions. And finally, collaboratively, parent child will agree upon on one solution. And both the parent child will start implementing the agreed upon solution. Hence, my dear friends, collaborative problem solving helps the adult to pursue their expectation while reducing the challenging behavior of the child by helping them to build a good relationship between the child and the parent. Invariably, in a children with a disruptive behavioral disorder, oppositional defiant disorder, in a conduct disorder, the symptoms are defiance and disobedience. In such a scenario, giving instruction, giving commanding, asking them to do certain things will not invariably work. Hence, we need to liaison with the child, collaborate with the child, and collaboratively solve the problem at hand. To conclude, my dear friends, disruptive behavior disorders such as ODD, conduct disorder, those behaviors are there in 3% of the children in the general population. In this, psychosocial treatment is the first line of treatment in disruptive behavioral disorders. Parent child interaction therapy not only teaches parents with the basic behavioral technique, such as positive and negative reinforcement, positive and negative punishment, contingency management, but also the therapist will coach the parents in parenting skills. That is, life coaching is done here so that the parents become empowered in parenting. Till date, parent child interaction therapy and parent management training are the effective treatment available for disruptive behavioral disorders in children. Thank you very much for giving your valuable time. Stay safe.